The burnout is real in healthcare right now. I've been a CRNA for 10 years now, a nurse for 15 years, and what I'm seeing now with the level of care of patients and just in the eyes of the providers and the nurses, everyone is tired, okay? Went through COVID, was such a life-changing experience. While everyone was at home, healthcare workers were still busting their asses in the hospital, taking on patient loads that were unheard of, and we never got a break. And then fast forward 5 years later, I feel like we were able to, when times are hard and tough and take on all these patient loads. Now it's kind of like, well, you did it before, you can keep doing it. Like, why you need to change standard? That you were operating at such a high level, taking on more higher patient loads, sicker patients, and here we are 5 years still expected to work that way with no, now the pay has gone down, so probably not getting that COVID pay, but still doing a bigger workload. People are tired. They're exhausted. It's showing up in the way we're treating one another. It's showing up in the way patients are being taken care of. It's showing up in how we're taking care of ourselves. Because we are giving so much, now our cup is empty and we have to find ways to fill it up because it's our responsibility. We have to take care of ourselves so that we can take care of others. You can't be a healthcare worker and take care of others when you can't take care of yourself. So how do we get to that point? As a collective, we have to come together. We have to save healthcare. We have to save ourselves, save our beautiful nursing profession. The professions are probably suffering, but because I'm a nurse, of course, I notice nursing more. Instead of pointing the finger and negative or talking down on one another, how can we uplift one another? How can we encourage one another? How can we spread the love, the care that we want to give not only to our patients, but to ourselves? And it starts within caring for our colleagues, a team, taking care of one another. I remember when I was a new nurse, I was well taken care of. I was with some of the greatest nurses who trained me in the ICU. And had our boss lady who held us accountable and does evolve and develop our nursing skills and held us accountable to the type of level of patient care that we would want for someone we loved. I'm just not seeing that anymore. And I want to know, like, what can we do to get even better? We probably won't ever get back to the baseline, but let's improve. Let's keep getting better. Let's show up for ourselves and for our patients, because the one great thing about nursing is that it's always been a well-trusted profession, right? And even when they talk about all this AI and what it can take away, and nursing always seemed protected because there's no way to generate the human touch, the compassion, the empathy. I'm seeing now it's the lack of compassion, the lack of care. And I don't think it's coming from a place of malice. I think it's coming from a place of exhaustion, of burnout, of being tired. So how do we heal that? Because if we're going to act like robots, just go through the motions and not add that nursing touch, that care, that empathy, then yeah, a robot can do our job. And they're going to pass the meds on time, take care of the patient, the basics, but they're not going to have that human touch. And that's what makes us so special and so unique in what we do. Now, I will say, I think some people have come into the field, money, and realize, because the money and the rates were high and paid, not realizing what it takes to be a nurse, what it takes to be a care provider, pour a lot of ourselves into taking care of someone else. And even if you've ever taken care of anyone or anything, you get that. But think about that. That's what we go in, and that's our job and what we do. We go in, we care, we nurture people when they're at the most vulnerable states of their life. Not only are we there for the patient, usually we're interacting with the family. We're calming them, making sure they feel safe, that they feel loved, that they feel cared for. Something going on now where we're missing out on that, but I'm very hopeful that it will come back. It's needed. Are sicker these days just from everything going on in the world, our diets, our lifestyles, not moving, our mental health, not being able to afford the care we need, care. So we wait until things get to terrible position before we seek care. But so 3 ways I believe we can start working towards back our healthcare, making it a loving, safe place for not only our patients, but for ourselves. Rid of these toxic work environments. We're in the field of healing people and taking care of one another. So it should feel like a place of healing for everyone, okay? The 3 things I believe will help. Number 1, when you're at work, when you're caring between people, patients, cleanse your hands with cold water. Water is so powerful, it's so healing. The ritual that And if you're scared of the word ritual, it's a practice. Let's use practice. Okay. I don't want to get too woo on y'all, I know. Cleansing your hands is a good practice in between patient care, not only to cleanse yourself of any impurity, negativity, and just kind of things going. I think we've had the addition of your little pump, hand sanitizers everywhere, so we've kind of away from getting to the water, but the water is important. Get to the water, cleanse your hands, okay? Between patients, if you're starting to feel heavy at work, cold water, it makes you present, it grounds you. Trust me on that. Get to the water. Number 2, be kind. And when I say be kind not only to your colleagues, be kind to your patients, and be kind to yourself. And that looks like take your break, go to the bathroom, eat your food, okay? Take care of yourself. So probably starting with that first. Be kind to yourself. Because I think we've gotten into the mode of not only neglecting ourselves when we're at work, and I think that's kind of a battle when you're caring for someone, you kind of them above and forget about yourself, but you got to remember about yourself because it's important so you don't burn yourself out, okay? Be kind to your colleagues, and be kind to your patient. Number 3, be a team player. We're all a team. It takes everybody from the person who turned the lights on in the building for the hospital to the person who, the orders, run the shots. It takes us all. It's a team effort, right? So let's be a team. We're all, especially when we have a patient, it's not one person's responsibility. Like my instance, I work in the operating room. Me, have a circulating nurse, we have scrub tech, we have PCAs who come and help us position the patient, we have the surgeon, we have the surgical assistant is involved in the patient care, and we should all hold ourselves accountable into that standard. Like the patient needs something, we should all be willing to help the patient, not point our finger, well, that's what you're supposed to be doing, that's your job. You know what I mean? Like centered care. That's what was really a focus on me when I graduated from nursing school in 2011. Everything was patient-centered care. And it worked. Like when I worked bedside in the ICU, I didn't even feel like I had a job. Like I just felt like I was coming in, taking care of my peeps, hanging out with my cool crew, and I get paid. It was wonderful. Like everything. Now, don't get me wrong, we had our tough nights. Let me bring it back. You are sick. Some nights you'll work, but it didn't like on me as much because I knew I had a solid team. Was a loving, supportive environment, and it makes the biggest difference, especially in the field we're in. We can't be mean to each other. We can't try to put the sole responsibility on one person because it was never meant for one person. It's a team effort. So we all need to hold ourselves accountable. We all at work, but we all getting paid. Not volunteer work. We all have a responsibility, and we all need to chip in and take care of the patient and stop trying to put that burden on one person. And then when we balance it out, it feels a lot better for everyone involved. Even it reflects for the patient care too, because the patient's paying attention to what's going on. They be seeing, they know. I've been a patient myself a couple of times. Yeah, we're gonna wash our hands with cold water. We're going to be kind, and we're going to play as a team member. Now go be blessed.